Artificial Intelligence Doctor. ABC Pharma.net. Leadless Pacemakers versus LBBAP. For years, pacemakers have relied on leads. But today, two advanced technologies are changing the game. On one side, we have leadless pacemakers, tiny devices that don't use leads at all. And on the other, left bundle branch area pacing, or LBBAP, a new, more physiological way to use a traditional lead. What's the difference, and which one is right for the patient? First, the leadless pacemaker. This self-contained unit is implanted directly into the right ventricle through a catheter in the femoral vein. There's no need for leads running through the blood vessels and no surgical pocket in the chest. Because it paces the right ventricle directly, it can be a non-physiological form of pacing. While effective, it can sometimes cause less synchronized heart contractions. Next, let's look at left bundle branch area pacing, or LBBAP. This technique uses a standard lead, but instead of just sitting in the right ventricle, the doctor carefully places it deep inside the wall that separates the ventricles. This allows it to capture and stimulate the heart's natural electrical highway, the left bundle branch. This results in more synchronized, physiological contractions, similar to a healthy heart. Let's break down the key differences. Pacing mechanism. LP, standard right ventricle pacing. LBBAP, physiological conduction system pacing. Hardware and procedure. LP, no leads, no surgical pocket. Implanted via a femoral vein catheter. LBBAP requires a traditional lead and a pulse generator in a chest pocket. Infection risk. LP, the risk of device-related infection is significantly lower since there's no lead or pocket. LBBAP, the risk is higher, though still low, compared to LPs, due to the need for a lead and pocket. Pacing capability. LP currently offers only single-chamber pacing. LBBAP can provide single, dual, and even resynchronization therapy for more complex needs. Left ventricular function. LP, high-burden RV pacing can sometimes worsen heart function in vulnerable patients. LBBAP, the physiological pacing can actually improve function, especially in heart failure patients. So, which one is the right choice? It depends entirely on the patient. The leadless pacemaker is an excellent option for patients who need single-chamber pacing and are at high risk for infection. LBBAP is the superior choice for patients with heart failure or those requiring more comprehensive, dual-chamber pacing due to its physiological benefits. And the future is still evolving. We're seeing early studies on dual-chamber leadless systems and even leadless devices that can perform conduction system pacing. These innovations promise to bring the best of both worlds to a wider range of patients. The landscape of cardiac pacing is changing fast. Understanding these technologies is key to making the best decision for a patient's long-term health. Explore more at Artificial Intelligence Doctor. ABC Pharma.net.